Our scan data orientation, we always want it to be for the maxillary, looking straight down on the occlusal table. And for a double arch or a mandibular case, if this were the mandibular arch, well, let me just pull that one in to show you. If this were going to be a mandibular all on four, we would want the scan data orientation like this, looking down on the occlusal table, but with the jaw pointing downwards. If you're doing a double jaw, upper and lower, it's going to be the exact same thing as with the mandible. You're going to be having the mandibular facing down like this. You might think, at least I did initially, when you're doing a double jaw, it would make sense that it's like this, straight on. But no, it's for the double jaw, you're looking straight down on the occlusal table of the mandible. So since we're doing the maxillary, we're going to do our scan data orientation like this. And we're going to hit next. And that locks in the orientation. Okay, so here now we're just waiting on the surgery. So before any extractions are done, but after anesthesia has taken effect, uh, we need a fiducial marker placed, and that fiducial marker will stay in place throughout the surgery and act as an alignment marker for all subsequent scans. So we have that, so I'm going to pull that in. I'm going to go to expert mode here, tools, and add remove mesh, and we're going to pull in a generic visualization mesh here. And this scan is purely for alignment purposes. The software doesn't need it for any sort of design reasons. So we're just going to import the surgical scan with the arch tracer. So this is arch tracer with teeth. This is the first scan you do before removing any teeth or flapping. There are workflows where you flap and then place the arch tracer on the bone, and you can do your final scans before suturing and start designing before suturing. But to keep things simple, we're going to show kind of the most simple workflow, the easiest to understand, and that is this one here. So you can see this scan. It's essentially the same as the pre-op scan, but now we have this arch tracer that's been placed in the palate. For mandibular cases, arch tracers can be placed in the retromolar pads or at the midline, in the anterior mandible, wherever you're not going to be placing implants. You can essentially, or reducing bone, placing implants or reducing bone, you can place an arch tracer in that location. So I'm going to remove the lower here so we can see a little bit better. So I'm going to align this scan here to the pre-op scan, the pre-op records where everything's already kind of in alignment to the wax up. And I'm going to use all this scan data on the teeth themselves for alignment. Just going to pick some random teeth. So as we know, soft tissue is not quite as stable as hard tissue or consistent over time. So what I'm going to do is see how close of an alignment this is. And the software is using basically all the scan data between the two scans. And we can see that there is some good alignment on these. And honestly, this would probably be plenty accurate. But just to show real quick how we can do it a little bit better, after we have our point alignment, I'm going to click this box here, and it says matching exclude selected parts. So nothing's selected right now, so it's still not excluding anywhere. So I'm going to invert the markings. Now everything is selected. So everything's excluded. So this would not be able to do an alignment. But what I'm going to do is hit shift and left click, and I'm going to unselect the teeth. And this is going to tell the software to only use these unselected areas for alignment. And now we'll go ahead and perform the alignment and then best fit matching. Okay, so I can already tell it's going to be a better fit. So I'm going to exit out of this box and click show distance. And now you can see how much better that is. There's way more uh, dark blue salt and peppered throughout the teeth. And if we do a cut view here, we can see how much better that is. Okay, so that's kind of step number one during the surgery. Now we're just hanging out in exocad while the teeth are extracted, bone is reduced, the four implants are placed, multi-unit abutments are placed, and then an opti splint is assembled. And that opti splint is assembled intraorally and then removed and scanned with an intraoral scanner extraorally on the scan plate, or put in a even better, put in a desktop scanner for more accuracy. And it's so much easier during surgery with a lot of blood, saliva, and things like that to be able to scan these things extraorally. If using an intraoral scan, it's going to be that much more accurate because the scan bodies are cleaned and dried. And then, of course, if it's done in a desktop scanner, you get the accuracy of a desktop scanner. So uh, once that's done, then the multi-unit abutment healing caps are put in place on the abutments, and suturing is completed. After the suturing is completed, then an intraoral scan of the soft tissue and the scan caps is completed. And that is the next scan we're going to import. So I'm going to go ahead and add another mesh, and that is going to be the actual jaw scan. So I'm going to just click extra jaw scan here, and we're going to load this one right here, MUA scan cap and tissue scan. And we need to align that. But if we go back to Wizard, it's probably going to have us align it to this one. But I'm going to click next. I want it to replace the whole scan data because this original one, as I mentioned before, was just a placeholder. So we're just going to replace it. We don't want to merge it because this old one still has teeth. So we just want to replace the entire scan data. And then I'm going to jump back and do the alignment because it's way out here. And we're going to use the same highlighting tool to just highlight the arch tracer. So I'm just going to pick a couple of these corners here to do the point alignment. And then we're going to click this tool, exclude selected parts, invert markings, and then we're just going to highlight this arch tracer here. Highlight it over here. And now we can show how good of an alignment that is with all the dark blue. So that should be a really accurate occlusion. Okay, so we're getting there. So now we have our tissue scan aligned, and the last remaining thing is to replace our placeholder for the actual implant positions using the opti splint. And so we're going to go back to tools, add remove mesh, and we're going to just replace the scan marker scan. Do you want to replace it? Yep. And this is going to be our opti splint scan on scan plate. And I'm just going to orient it in the similar position as the jaw scan with the multi-unit abutment scan caps, just for ease of alignment. So essentially, these scan caps are the same geometry as the buccal or facial half of the actual opti-splint scan bodies. So for alignment purposes, we're just going to click a point on the buccal or facial aspect of each scan body and match it to its corresponding facial aspect of the multi-unit abutment scan caps. And for best alignment, again, we're going to use this. It might not need it in this case, but I'm going to do it anyways because it doesn't hurt, and if anything, it helps the accuracy of the alignment. Okay, so pretty decent. Not perfect on this one. I kind of chalk that up to discrepancies in the intraoral scan with all the uh, saliva and blood on the soft tissue. But these three are pretty decent, so that looks like a good alignment.